We're now crossing to Ukraine to speak to a doctor with Israel's Sheba Medical Centre, which has established a civilian field hospital in the country, accommodating 150 patients per day. Joining me now is Dr. Galia Barkai, head of the Paediatric Infectious Disease Unit at Sheba Children's Hospital. Galia, the field hospital opened its doors last week. Tell me how many patients you have seen so far and what sort of care do they need?
So we've seen about 1,400 patients so far in 9 days. We've seen many elderly people who suffer from lack of medical supplies, medicine going on now. They really need a lot of extra care, and we've brought to them the best of Israeli doctors. We've brought to them high-level medicine from Israel. So many people hear about the hospital and come to get second opinion, to get treatment for their chronic diseases, sometimes acute disease. We've done some surgeries. Today we had our first C-section. So we see a lot of patients here who are really in need of medical help.
And how are the women and children coping with what's happening in the country?
So I must say that only about 10 to 15% of patients are refugees that come from the war areas. And the people here the area where we are is close to the border with Poland. The people here are having them in their houses, and they're taking very good care of other Ukrainian people. And so we've seen people fleeing from the war, many with trauma, children and adults that are traumatized and need psychological and psychiatric help. Many of them have been really, very weak, and their chronic disease have gone worse. They're very, they're down. They're worried about what will happen with their country, but all of them are very sure that they will win the war, and they're pretty sure and confident about the future of Ukraine, and they don't let go. They're very strong people. It's amazing.
Yeah, it's incredible people who are facing just enormous challenges. Do you have any fear for your own safety? You mentioned where you are is near the Polish border, but you have gone into a country that's at war. Have you got any concerns for your safety and the safety of your staff?
So people around here, the Ministry of External Affairs of Israel and the local people here, the local police, are taking very good care of us. And sometimes there are sirens coming from Lviv, and we go down to the shelter. But I'm not really worried. They didn't have bombings here at this area or at the periphery of this area, so I'm not worried about our safety. I'm confident. Thank you.
Well, you're doing incredible work. We're all absolutely in awe of medical professionals who choose to go into a dangerous situation like that and help people who desperately need it. Doctor, thank you so much for joining me this evening.